the Samhita Adhyayana. Without further delay, I would like to call upon Dr. Mulidhar Sharma sir, STMCA ODP, to take over the session. Welcome to you, sir.
अर्थात् स्वभावविप्रतिपत्तिम् अध्यायं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. Now the changes which occur in the natural content status of the body, something which is visible to the naked eye and which can predict about the outcome or prognosis of the patients, that's in the स्वभावविप्रतिपत्ति. स्वभावसिद्धानां शरीर एकदेशानाम् अन्यभावित्वं मरणाय, the natural appearances and natural activities in the body, when they are altered, that's a sign of the disease which can lead to the fatal complications. तद्यथा शुक्लानां कृष्णत्वं, कृष्णानां शुक्लता, रक्तानां अन्यवर्णत्वं, where there is a color change, something which has to be fair or whitish in color, if it changes to black or black changes to white, or the reddish color changes. Sthiranam mrudutvam mrudunam sthirata, when the consistency of an organ is changed, like either it may, a soft organ may become harder or harder may become softer. Chalanam achalatvam achalanam chalata, a movable organ or movable part of the body, it becomes immovable, or a immovable part becomes movable. Prutunam sankshiktvatvam sankshikthanam prutata, if there is a change in the size, a hypertrophy or atrophy of a organ. Dirghanam sasvatvam sasvanam dirghata, if the dimensions of an organ are changed and if there is either constriction or a extension or increase in the size. Apatana dharminam padana dharmitvam, something which is fixed, if it tends to become movable. Patana dharminam apatana dharmitvam, something which is movable if it becomes fixed. Shaitya austya snaidhya rauksha prastambha vaivarnya avasadam changana, if any of the organs of the body would show changes in the temperature, in the surface characters like either smooth or roughness, or if there is a abnormality of the sensation or discoloration, that's considered as a possible sign of a underlying disease which you have to evaluate. Now I will show you some of the examples. Now, of course, it's a, you can give hundreds and plenty of examples of that. I'm showing you a few of the examples which are quite important from the clinical point of view. A patient having this blackish discoloration with hyperkeratinization, acanthosis nigricans, as a sign, which could be produced due to hundreds of causes. And the one of the important thing which you have to rule out is when a patient presents with this, and where there is an appearance of blackish discoloration in the areas where the skin is stretchable, like the neck, axilla, etc. One of the things which you have to rule out would be carcinoma of the stomach. Of course, it's not that every patient presents with nigricans has a carcinoma, but if the patient has any gastrointestinal tract symptoms, we have to specifically inquire about that. And if there is a need, we may have to go for further investigations. And it could be one of the clinical presentations of a underlying pathology like carcinoma of the stomach, which is many times patients would not bother much about the abdomen, but they may have more worry about the skin signs where there will be a blackish discoloration. And if we are able to identify, that's a contribution to the patient, that's helpful to the patient. Shuklanam Krishnatvam, a area when it becomes blackish, it could be suggestive of the severe pathology. Similarly, a blackish discoloration without much of a keratosis, a smooth surface area where there is a blackish discoloration, it could be suggestive of a renal pathology. So whenever a patient presents with that changes of the color, you have to have this kind of a discrimination and assess clinically, which can help in making the diagnosis more accurately. And many times the missing diagnosis can be tracked out by looking at these signs. A blackish discoloration without this keratosis could be suggestive of a renal pathology, and particularly renal pathology produced due to systemic fibrosis. Now, Raktanam Anivarnatvam, if there is a reddish discoloration, now patients presenting with the reddish discoloration could be of many causes. And a patient presenting with the reddish discoloration and itching, of course, you will have dermatological causes like local irritation, allergy, and so on. But beyond that, The irritation could be that reddish discoloration or pruritus can be produced due to other diseases like hematological disorders, plenty of hematological disorders like sickle cell anemia or even polycythemia like conditions, iron deficiency anemia, and pathologies of the bone marrow, or even myeloma, lymphoma, renal disorders of uremia, liver disorders, endocrine disorders, so on. So there could be plenty of such causes for the pruritus. So in a patient present with the pruritus, you will have to consider all these possibilities and then come to a diagnosis. Similarly, erythema, reddish patchy lesions, again Krishnatvam or Raktanamanya Varnatvam, when there is a reddish discoloration, if it is presented as a patchy conditions, you will have to think of plenty of other causes like any infective pathologies. It could be presented in colitis like ulcerative colitis like conditions, leukemias, in many in lymphomas after the radiation, or some of the drugs like sulfonamide, amoxicillin, they also can produce a similar thing as such. Prutunam Sanshiptam or Sanshiptanam Prututa. An example could be a muscle atrophy. Again, once a patient has a muscle atrophy, you will have to think of the other possible causes, neurological causes, or maybe the systemic pathologies which can result in, or the genetic pathologies like muscular dystrophy, and so on. So, your evaluation would be of a elaborate thing. Or Sanshiptanam Prututa, enlargement, hypertrophy, hepatomegaly. Again, the causes could be many as such. So that's how it has to be evaluated. Or a Shautya Aushna strength Rokshastamba Vivarnyavasadam Changana. When there is an abnormality which is seen over the surface, either in terms of the shape, abnormalities of the tape, Avasadam, or Snechteroksha, the appearance would be either rough or smooth and so on. That could be the clinical signs as such. So all that whatever Sushruta has said is very relevant if you apply it to the practical clinical conditions, which can be an important clue to make the diagnosis. Now, some more of those are Swebhyasthanibhya Sharira Ekadeshanam Avastrasta Utshipta, Bhranta, Avakshita, Patita, Vimukta, Nirgata, Antargata, Guru Laghutwani. If there is any organ or any of the organs of the body would be avasprastha, displaced, ukshipta, if it is lifted up or raised up, bhranta, again twisted or position is altered, and avakshipta, if it is moving downwards, patita, that's if it is not functioning or not moving at all, vimukta, if it is detached from its insertion or location, nirgata, depressed, antargata, totally concealed, if it is concealed, that's the typical features. Now, to highlight this, to give you typical meaning of this, I will give you some of the examples of this. In a myasthenia gravis, when the eyelids drooped, that's avastrasta, where the shape, the eyes are not able to open fully because of the drooping of the eyelids. Whereas ukshita, the eyelids being prominent in case of the extrapolus of hyperthyroidism, or in case of thesis, that's where the eyeballs are degenerated, or injury to the eyeball results in thesis, that's antargata. Or similarly, you will have the typical features of the palsies, cranial nerve palsies, which can be made out. Like if there's a third nerve palsy, you will have a typical picture where the patient's eye, the focus of the eyes will be towards the periphery, and the primary focus, the total height, there will be a squint as such, and in the resting condition, you will see that one of the eye would have a squint, whereas the other eye would not have the squint. When the attempts to visible see, you will see that the one eyeball moves, but the other eyeball doesn't move. This kind of appearance is avakshita, or bhranta, where there is a confusion, like fourth nerve palsy, where you will have a confusion, like when the one eye elevates as it moves medially, whereas the other eye further apart, like significantly moving, like. So this kind of an appearance is typical of the fourth nerve palsy, whereas a sixth nerve palsy, the facial palsy, which is often seen, you will see the patient will be able to abduct the right eye, but no obvious squint. The movement of the eyeballs are not symmetrical. Utkshipta. These are maybe the examples of these words as such. Then Prabalavarna Venga Pradurbhava Vapi Akasmat Siranam Darshanam Lalate. Now a Prabalavarna Venga. reddish coral colored patches over body, which could be the typical purpura or porphyria-like conditions. So whenever a patient presents with that, you need to think of the systemic diseases which can be of more serious consequences. Siranam Darshanam Lalate, if there is a bulging vessels over the surface of the body, anywhere, either it could be the skull or anywhere, it's suggestive of a arteriovenous fistula, which could be a pulsatile mass, and there again, the approach to the treatment would be again elaborate. You need to evaluate further and think of maybe the intervention. NASA Umsheta Pedokopati, if there is a focus of infection around the nose, which we consider as the danger area of the face. That's a very important thing. A patient presenting with the infective focus at the area around the nose and the lips in that area would have a very high risk of cavernous sinus thrombosis, because there is a direct connection. The vessels from the nasal area, they will reach to the cavernous sinus directly, and a septic focus can result in a cavernous sinus thrombosis. And if there is a cavernous sinus thrombosis, it can be fatal, acutely fatal, and this cavernous sinus connection is one of the important area, and hence in the practical surgical conditions we consider this area of the face as the danger area of the face. So whenever there is even a relatively minor infective focus in this area, like a simple pimple, you need to be very careful in managing that condition. That's the idea. Lalateva prabhatakale swedha, a excess of sweating over the forehead, sudden onset without other specific causes like the environmental factors. Causes could be many. So whenever a patient presents that history of excess of sweating, you need to think of the conditions like myocardial infarction, anaphylactic shock, alcohol withdrawal, certain of the drugs which also can produce these kind of sweating, hyperthyroidism, pregnancy, diabetes, leukemias. These are all the conditions which can produce excess of sweating. Now, whenever, and particularly excessive sweating in the face and extremities, in the face as well as extremities, you need to think of these conditions. So, these symptoms, though they may look like a simple symptom, you need to evaluate further and careful. Netraroga vina ashrupravritti, if there is a excess of tear secretion without any these visible pathologies of eyes. Now, conditions where there is injury to the eye or irritation of the eyes and then tear is something else. But if there is a excess of secretion of the tears without any injury or without any damage to the eyes, it could be a sign of a Bell's palsy or systemic pathology like Sjogren syndrome, which is a variant of rheumatoid pathology, autoimmune pathology, or hyperthyroidism also can present with the same. Rheumatoid arthritis also can present with infiltration in the eyes and then secretions can occur. Chemotherapy or radiation also can produce a similar irritation of the conjunctiva and there could be secretions. गोमयचूर्ण प्रकाशस्य वा रजसः दर्शनम् उत्तमाङ्गे निलयनं वा कपोतकङ्ककाक प्रभृतीनां. Now, if there is a roughness over the surface and scaling of the skin, and the scaling of the skin which resembles that of a gomayachurna, cow dung-like appearance, or it could be like dust, fine dust-like. Now, which is quite common seen in case of either psoriasis-like condition or severe eczema-like conditions. Or nilayanam va kapotakanka kaka pravritinam, a shape which resembles certain of the animals, birds, etc. We use the term butterfly wing shaped discoloration in SLE. Now, Sushila has used the word kapotakanka kaka pravritinam, which looks like the shapes of some birds or so on, patchy lesions with the scalings or without scalings over any specific area of the body with a definite shape. They could be suggestive of the certain disease. One of the example would be SLE, lupus erythematosus, where you will have a typical lesion over the face, which is often named as a butterfly wing shaped lesion. Mutrapurisha vruddhihi abhunjanam, tat pranasho va abhunjanam. A patient having a lesser passage of either the urine or the stools even after having food, or if a patient has the excess of passage of the stools even without having the food, or both these, that which we now consider as the irritable bowel pathologies. Now, irritable bowel pathologies, characteristically the clinical symptoms would be of irregular bowel movements, which could be in both the ways. Like even if the patient doesn't consume food, there could be excess acid, or if the patient even if the patient consumes sufficient food, it could be like this constipation. It could be the presentation could be due to many of the other conditions. One of the important development in the new development in the contemporary system is a study of gut-brain axis. Gut-brain axis relations between the diet and the functions of the colon with the functions of the brain. Now, this gut-brain axis also is a hypothesis which can be attributed to the functions of the vata sthana, this distal portion, pakvasha, they being the vata sthana, which regulates the forces, all the activities of the body. That itself is the basics of what we say as gut-brain axis. In the gut-brain axis, beyond that kind of a issue of relating to the mental, the psychological functions as well as the intellectual functions related to the colon, or related to the gut acid, I would not say colon, gastrointestinal tract as a whole. The other part is neurological control of the replication directly related to the functions of the brain is another issue, and most of the times that irritable bowel syndrome is considered as a psychosomatic condition as such. Anyway, that's one issue. Sanamula hridaya urasya shulokpratyaya, pain, all of a sudden severe pain occurring at the area of the chest. Either it could be around the breast or in the middle of the chest. These are the areas. Whenever a patient presents with the pain over the chest area, particularly if these are the locations in the upper chest or substernal and radiating to the neck, or substernal radiating to arms directly, epigastric pain, epigastric with radiating to the neck, or neck and jaw pain occurring in neck and jaw, pain occurring at the left shoulder, or pain in the posterior surface. These are all the areas which have to be considered as a possible cause of myocardial pathology. A patient presenting with the pain in these areas, you have to be careful. I don't say that every patient presenting with these symptoms are having only the cardiac pathology, but when the pain is located at this area, and if there are any other sufficient collateral evidences, you need to think of the cardiac pathology and evaluate, should not neglect that. So that's exactly what Sushila means by Stanamula Hridaya Urasu Shulotpataya. Madhye Shunatvam Anteshu Parimlayitvam Viparyayova Tata Ardhangyeshvayatuhu Shesho Angapakshayurva. Now, the shapes of the body, visible shapes of the body, and the obesity, that collection of the fat, by which you can make out the diagnosis. By looking at the shape of the body itself, to a great extent you can make out that the obesity or abnormality of the fat metabolism. It could be by looking at the shape of the body, it could be the abnormality of the genitourinary system, where you will have more fat accumulated at the buttocks area, bulging of the buttocks, whereas upper part of the body doesn't show that kind of an obesity. Whereas a pathology of the thyroid, it shows this accumulation of the fat both in the abdomen as well as the buttocks. So the whole buttocks or abdomen would be pear shaped. Like if there is a adrenal pathology produces somewhat generalized this accumulation of the fat. The fat would be mainly more over the this abdomen and thorax as well as abdomen. Limbs also will show to a certain extent about the evidences. Pituitary pathology would produce a shortening, the height will be lesser, as well as there will be a generalized accumulation of the fat. Now, in general, the obesity, patients with obesity or body fat, they are categorized under 6 categories based upon the shape. Now, with this, again, the prediction of the prognosis can be predicted to a certain extent. If particularly the first 3, where the patient has a upper body abdomen or lower abdomen area and large stomach belt, these 3 patients of obesity, they have a higher risk of developing the complications of the obesity, whereas the next 3, they have comparatively lesser chance of developing the complications of the obesity. So anyway, the important reason you have to you can make out a significant diagnosis, or the whole clinical approach can be made easier if you observe these things, the shapes of the body as such. And further, once you get some clue about this, further investigations and analysis could be easier. And that's exactly the importance of the clinical observation there. ನಷ್ಟಹೀನ ವಿಕಲ ವಿಕೃತ ಸ್ವರತಾವ ವಿವರಣ ಪುಷ್ಪ ಪ್ರಾದುರ್ಭಾವವಾದಂತಹ ಖನಕ ಶರೀರೇಶು if there is a loss of any of the facial or the voice, impairment of the voice, or abnormalities of the teeth and gums, abnormality of the teeth and gums, or if there is a accumulation or formation of abnormal substances, deposition of the substances over the teeth, they also could be a sign of systemic disorder. Patients presenting with the abnormalities of the gums and particularly periodontitis, where there is an infective pathology around the gums and the secretions, the causes could be many. So whenever a patient with abnormal gums and teeth, it's not only the tooth pathology, it's not only the dentist area, there could be plenty of other causes which could be a cause for or which could be a cause of concern from the clinical point of view. The common causes of chronic periodontitis, where a patient would have multiple these very chronic conditions, could be starting from simple pathologies like metabolic disorders, severe pathology like cancers, or it could be plenty of other causes as such, which you will have to think of and analyze. It could be due to many diseases conditions, and hence they have to be analyzed and they have to be treated as such. That's the point. Now, यस्यैव अप्सु कफपुरीशरेतां निमज्जति. If the stools or even the sputum this dips in water, that's the specific gravity is more if there's particularly with the stools. Now, with the Purisha Pariksha, the Mala Pariksha, a standard protocol, which is practiced in as per the text, is about seeing the same, like if there is a substance with high specific gravity in the stools, that again suggestive of a malabsorption. If the absorption is not proper, digestion is not proper, this occurs, and this can result in the evidence of the diseases. Present clinical practice, there would be an analysis or appearance of the stools, visible appearance of the stools is categorized based upon the appearance, not simply because whether it dips in water or not, but whether it dips in water also has relevance. So in the present clinical practice, instead of going for that test like the Jala Nimajjana Pariksha, that whether it dips in water or not, what we follow is the Bristol stool chart, where you will see the consistency of the stools as shown in the diagram, starting from type 1 to type 7, by which you can make out like what could be the causes like. It could be the dietary abnormalities like lacking of the fiber, if there is a soft blobs with the clear cut edges, or it could be like in a severe constipation, you will have that separated hard lumps as such, or diarrhea, of course, watery, so on. So the stools visibility test. In the present day situation, we have a standardized protocol like Bristol stool chart, whereas in Sushruta and Charaka, our Ayurvedic practice is about the Jala Nimajjana, which has a very relevance. यस्यैव दृष्टिमण्डले भिन्न विकृतानि रूपाणि आलोक्यन्ते. If there is an abnormality of the field of vision, now Sushruta has said this in a single sentence, single word, like abnormality of the field of vision. Now you may have more categories, naming them with the different names, and with the study as such, different instruments can be used to make out the scotomas, different varieties of the scotomas, and these scotomas also would have a relevance with the systemic pathologies, different identification of the scotomas. Now with the advanced technology, you can further go into detail. So all that what I mean to say is, whatever Sushruta has mentioned is in a brief sutra form. Now you can expand it to any extent with the current technology, but basically it's the same thing which is there. Snehatyakta kesham viva yobhati. If the surface of the skin looks like having a oily layer, or even there could be abnormality of the hairs also in a similar situation, which is very characteristic of the systemic sclerosis. A sclerosis of different, again, causes could be many. A patient having a systemic sclerosis, you will have to evaluate the causes for that, and again it can be complication, can result in many serious issues in the clinical practice. So you have to evaluate that very clinically. So all these are the clinical signs which show you a sign of concern, which need more intense clinical evaluation, and that's what Sushil says as such. This could be a sign of the systemic sclerosis as such. Now, यश्च दुर्बलः भक्तक्लेश अतिसाराभ्यां पीड्यते, a patient who is emaciated has dyspepsia or diarrhea or both. That would be again a poor sign of poor prognosis. Kasamanascha Krishnabhibhutah, a person who has excess of cough and at the same time he has an excess of thirst also, thirst and cough together. This also would be sign of poor prognosis. Of course, these are all the Bhakta Dveshatisara, quite obviously a patient who is emaciated, and if his gastrointestinal tract functions are not normal, he is not taking food properly, and if he has a diarrhea, naturally that outcome would be poor. A patient with coughing having excess of thirst, sign of dehydration, again it could be a poor sign. क्षीणः छर्दिभक्तद्वेषयुक्तः सर्पेण पूय रुचिरोद्गामी हतस्वरः शूलाभिपन्नश्च मनुष्यः. A emaciated patient who has vomiting as well as bhaktadvesha, dyspepsia, or a patient who omits out sapena puya rujiraha, either blood or pus mixed vomitus, and if the voice intensity of the voice is impaired, shirabhipannaha, if there is a severe pain also. This again is suggestive of a severe gastrointestinal pathology, where you will have to think of either obstructive pathologies or conditions of infective origin in the abdomen. शूल करचरण वदन क्षीण अन्नद्वेषी सस्तपिंडिकांश पाणिपातः ज्वरकाशाभिभूतः. Patient having fever and cough, if he develops edema in the feet or edema in the facial area, which could be again sign of either abnormality of the hydrostatic pressure or osmotic pressure. And very often you need to think of the renal conditions and cardiac conditions. And strastapindicamsa panipadaha, if there is muscle catch in the calf muscle area, which again could be an early sign of the electrolyte imbalances in the body. Now, a cachexia and emaciation, patient presenting with the cachexia and emaciation and accompanying symptoms. The important things which you have to consider. Now, in the present day situation, you will have a good number of patients who present with the cachexia, but whether otherwise there are no obvious evidences, and you need to evaluate. And these are the important conditions: anemia, hepatic dysfunctions, insulin resistance diabetes, down-regulated anabolism, that's where the patient has a protein energy malnourishment like conditions, catabolism updated as in case of hyperthyroidism, or renal pathologies. These are the important conditions you have to think of when a patient with the cachexia and the accompanying symptoms as such. So that's the basics of what Sushil has said about that. यस्तु पूर्वाण्य भक्तम अपराण्य छन्दयति अभिदग्धम अतिसार्यते वा सश्वासात् नीयते. Now, another very important clinical sign is a person who has consumed in the morning, consumed the food in the morning, omits out in the later part, is a sign of poor prognosis. Now, this is a very typical standard clinical sign in case of the hourglass stomach contractures. If a chronic gastric ulcer can result in a fibrosis, fibrous constriction can occur, and the stomach may have two compartments. Like in this condition, and it's when the patient omits out, when the patient has vomiting, the first vomitus would be vomitus of containing the food which was consumed just in the immediate past. The next bout of vomitus would be the food which is consumed much earlier. So there is a reverse sequence of the vomitus, which is very typical. If in general, whenever a patient vomits out otherwise in a normal conditions, the patient would be vomiting out the food substance which is consumed earlier first and then the later ones. Whereas in the patient with hourglass stomach, the situation would be reversed. And this kind of a phenomena is very characteristically seen in case of the hourglass stomach, which would be suggestive of a more severe pathology as such. And in a patient with a history of gastric ulcer, it's a direct evidence that the patient requires a surgical treatment. बस्तवद् विलपनिष्ठ भूमोपततिं स्वस्थमुष्टः स्तब्धमेढ्रो भग्नग्रीवः प्रणष्टमेहनश्च मनुष्यः. Seizures, patients developing sweet seizures, and if the patient falls down on the body or on the ground without either with that rapid movements, or if it could be limited to specific organs of the body. And Sushruta gives a very specific evidence of subdomain penis being constricted. Of course, in the present day situation, it may not be a very evident clinical sign, considered as a very clinical sign as such, but it could be like a partial, where the patient may have abnormalities of the movement of the neck or maybe certain part of the body, or pranashta mehanashta, the loss of control over the autonomic functions like mutilation. So when a patient presents with a seizure, now whenever you have a patient with the history of seizure, the approach would be you will have to confirm whether it is a partial seizure or generalized seizure. A generalized seizure where the whole of the body would be affected. It again could be categorized as absent seizure. Temporarily, person is just out of context and not able to make out what's going on. Myoclonic, where there could be repeated movements of the body to a limited area. Tonic and clonic, that's typical of grand mal epilepsy, where the patient initially would have a epistotonus, the bending of the body, then contractures, and then there will be relief. Tonic is only one, the contraction of the body, but not the repeated movements. Or atonic is where the tone is complete loss, the body is flaccid. Of course, more frequently what we see is these tonic, clonic, and tonic contractures in case of the grand mal epilepsy. Whereas in the partial seizures, it could be simple where temporarily a limited portion of the body has the seizures. Complex is where the seizure which has a similar or a similarity to any of the normal physiological activity, something like calling or what we call as the tics like. Secondary generalization is a seizure area in one area initially, then it spreads to the other part of the body. Gradually, it's from one area to the other. So these are how we classified or assessed. Whatever Sushruta has said is a minute or a miniature of these classifications. Like you will have to assess whether it's a generalized or localized, and Sushruta has specified the localization into the genital area and neck, whereas in the present approach, the approach is slightly different. But the basic concept of analysis is same. प्रविश्यमाणः हृदयः आर्द्रशरीरः प्राग् विशिष्यमाणः हृदयः आर्द्रशरीरः. If there is a excess of sweating throughout the body and the patient has a pain in the chest. Now, when it comes to the question of pain in the chest and then the excess of sweating, particularly with the excess of sweating in myocardial infarction, is a very dependable clinical sign. Patients of myocardial infarction is a very dependable sign. Now, a huge analysis, this is a report from huge analysis of patients of myocardial infarction with ST segment elevation analyzed, and their clinical symptoms are studied. The most common clinical symptoms is sweating, which is seen in 97% of the patients. Whereas the other typical signs, they may be varying somewhere in the 30 to 40% area, some may be very lesser. So mainly sweating. The next to that is typical angina. Next to that is palpitation. So and vertigo. These are all the clinical symptoms which could be seen in a patient of ST segment elevation myocardial infarction, and it's a very important data. This data is quite important. And when Sushruta says about the Ardha Sharira, the whole body having sweating with the pain in the chest, you need to think of a severe prognosis. Now, the abnormalities of the behavior, which again suggests about altered consciousness or what we call as hallucinations and so on. Este lostem lostena abhyanti castum castena. If somebody hits a piece of stone with another piece of stone or a piece of wood with other, that means he behaves irrelevantly. Trinani marchinati. He cuts the grass. Adharostam dashati. Bites the lower lip or uttarostam maledi. Licks the upper lip. Alunjatva karnam keshamsya. Pulls his ears or the hairs. Devat bija guru samsudamsya dvesti. Behaves abnormality with the senior persons, or maybe he doesn't have the proper respect or normal social behavior of respecting others is not followed. Yasya vakra anuvakragaha grahaha grahita stanagataha pidayanti. This is a part of astrology, right? Even if his horoscope shows the position of the graha in and predicts like something like which is a prediction, and that prediction is not felt or not seen, so which where the behavior or activities are other than that of what could be predicted based upon the horoscopes or the position of the grahas. Now this again questionable, like, but anyway, but Shustra has considered, we accept it. If we believe in it, it's acceptable. If you do not believe in it, just neglect it. Janma Rikshamwa, or it also depends upon the same birth and birth time as such, and the position of the celestial bodies. Yes, Ulka Ashanibhyam Abhiyanyate Horava, or if the natural calamities, feeling of natural calamities occur in, or feeling of that natural calamities are felt by the person, like some feels like there is a it is lightning or maybe rain or so on, when there is no such rain. ಗೃಹದಾರ ಶಯನ ಆಸನ ಯಾನ ವಾಹನ ಮಣಿರತ್ನ ಉಪಕರಣ ಗರ್ಹಿತ ಲಕ್ಷಣ ನಿಮಿತ್ತ ಪ್ರಾದುರ್ಭಾವೋ ವೇತಿ, or any of the nimitta lakshanas which could be produced or which could be perceived by the surroundings of the patient, like the house or maybe the bed or so on. So in the surroundings, now when looking at the surroundings, you can make out certain of the signs of the disease, like, and predict the prognosis. चिकित्स्यमानः सम्यक् सविकारो यो अभिवर्तते प्रक्षिण्ण बलमांसस्य रक्षणन्तर्गतायुषः निवर्तते महाव्याधिः सहसा यस्य देहिना न च आहारफलं यस्य दृश्यते स विनश्यति. Now the other signs of the prediction of the prognosis is, even after following a proper line of treatment, if the disease doesn't subside, and if the patient develops again at this emaciation, or maybe this physical vitality of the patient is reduced even after sufficient treatment, or if there is a recurrence of a huge disease after treatment, once you have treated successfully but immediately within a short period there is a recurrence, or the consumption of the food doesn't show the normal effects of the food. So once you consume the food, you will have a normal satiety, but if that normal satiety is not felt, that's also a sign of the aristolaction or fatal complications. एतानि अरिष्टरूपाणि सम्यक् बुध्येत योभिषेक साध्यासाध्य परीक्षाभ्यां सराज्ञः सम्मतो भवेत्. So you need to think of assess these clinical signs which could be predicting about certain serious complications, and a thorough analysis of that only make you a capable physician. इति सुश्रुतसंहितायां सूत्रस्थाने स्वभावविप्रतिपत्तिर्नाम 12ोऽध्यायः. Prognosis of a condition is assessed by various parameters and clinical observation. Keen observation is needed to identify these signs and correlate the pathology. With this, we will conclude today, and if there are any questions, we will try to answer, and then in case of systemic fibrosis in renal pathology, if the renal parameters normal, no, whether it is reversible or not, that depends upon the causes. Like if a systemic fibrosis occurring in a renal pathology is often not reversible. Only thing is, you will have to ensure that the deterioration doesn't occur faster. So fibrosis is always irreversible, but as far as the clinical condition is concerned, it depends upon the amount of the damage. If the damage is relatively poorer or lesser, then the patient may have a better recovery, otherwise not. So that's it, right? No other questions, so we'll wind up. Right.